Welcome to this special edition of Moving Minds webinar, brought to you by White Swan Foundation in partnership with Indian Medical Association and the Doctors for Doctors program of the IMA. I am Manoj Chandran. Just to give you a quick introduction of White Swan Foundation, we are a not-for-profit organization that delivers knowledge services for mental health and well-being. We have developed India's largest knowledge repository on mental health care for the people in different languages that serves thousands of people every day so that they make more informed decisions on this space. And Moving Minds is a platform that has allowed people to interact with each other and mental health experts to get their doubts cleared and build clarification so that again, they are able to better make decisions on their mental health care. So once again, welcome to this very interesting topic today. And today's title that we have for our Moving Minds webinar is Building Emotional Resilience. And this is exclusively curated for the medical students, interns, and resident doctors of the country. This is a webinar for medical students, and we shall begin by listening to them. And so here is a structure that I would just tell you about how we are going to spend the next 1.5 hours. So we begin with listening to the students. We will have 3 students tell us about what they think is the lay of the land from their perspective. After their talks, we will have a panel discussion. I'm so happy that we have a venerable group of experts with us as panelists today, and we would really be collecting some extremely valuable inputs on the topic of mental health and mental wellness for the students. Once again, welcome to you all, and let me now introduce you to my co-moderator. I'm so happy and delighted that I have with me Dr. Nilima Kadambi as co-moderator. Dr. Nilima is the chairperson of Indian Medical Association's National Committee for Emotional Health and Emotional Well-being of the medical students and doctors in India. A pediatric surgeon, Dr. Nilima is the vice president of Belle Sante Institute of Functional Medicine and vice president of Belle Sante Quality Compounding Pharmacy. Dr. Nilima, welcome to this webinar, and pleasure to have you with us today. Dr. Nilima, may I now request you to deliver the opening remarks and introduce our esteemed panelists and guests and student speakers to the participants. Thank you.
Thank you, Manoj. It's my pleasure to be a co-moderator, and on behalf of the Indian Medical Association and our initiative, which we have given the title of D4D, which stands for Doctors for Doctors, I welcome all our speakers, our panelists, and all the wonderful people who have joined this webinar and will participate in it in the form of Q&A through the chat box later. Just to give it a perspective, why are we doctors collaborating with the White Swan Foundation on mental health issues? Because 2 years back, the IMA decided to form this national committee for emotional health and well-being, keeping in mind the rising rate of burnout, distress, mental health challenges, and even sadly, increasing number of suicides of students and doctors in the prime of life. To lose out a potentially amazing doctor to stress, to burnout, or to mental health issues, or to suicide is really sad. And therefore, Doctors for Doctors was started saying we need to take care of our own and we need to take care of ourselves. And hence, today's topic of building emotional resilience is very, very vital. It has always been important, but the current pandemic has increased the awareness and the crying need for working towards this skill set that we all need to build. And therefore, today's webinar is very timely. And I must say, I'm very happy to have all the speakers and panelists, and I'm sure we'll have a wonderful discussion. Resilience, by its dictionary meaning, means the ability to bounce back. And today we need to have resilience because over and above the normal stress and strain of life and life as a professional in medical colleges and in hospitals, the pandemic has given many more new stresses in our lives. And the truth is, resilience builds when there is stress. Just like our immunity, what boosts our immunity is when we are exposed to those antigens in the form of a vaccine or an infection. And our body responds to that by actively fighting that infection. Similarly, resilience is built when we bravely and together face stresses and challenges and come out stronger and better. So, without further delay, I'd like to introduce our speakers for the day. If I could have the slides on the screen, it would be great. And just before we go into the actual webinar, I really need to state this very clearly, that everything that each of the speakers, be it a student or a panelist, expresses are their own views. We are not representing any one institution or any one organization or any one body. We are speaking what we believe from our hearts to be the honest truth about these issues. And we are sharing what we understand from our colleagues and friends. So let's begin without further ado. We have Lieutenant General Madhuri Kanitkar, a well-decorated Army officer of the highest rank in the country. She has been a ranking student and she has been the Dean of AFMC. A couple of years back, when she was the Dean, I remember telling her, just like Princess Diana was considered a people's princess, this dynamic lady who was the Dean of AFMC was very well loved by her students, and so she was a student's dean. So I'm very happy to have her and welcome Dr. Madhuri. Our next panelist is Dr. Sandeep Deshpande. He's an eminent psychiatrist. He's a gold medalist, and he has had decades experience in the UK. He also chairs the South Asian division of the Royal College of Psychiatrists, UK, in India. He's practicing in Bangalore, and something that maybe everyone may not know, but he does deal with a lot of transgender emotional health issues also. Dr. Suhas Chandran, a very dynamic member of our IMA D4D team. He's the assistant professor of psychiatry at the St. John's Medical College, and he directly interacts with UGs and PGs on a daily basis. He has also contributed, along with Dr. Deshpande, to what we like to call as the survival guide for MBBS. IMA D4D, along with the White Swan Foundation, brought out this wonderful book. It's an e-book which can be downloaded free. We brought it out in 2019, and Dr. Sandeep and Dr. Suhas were very large contributors to that wonderful handbook. Welcome, Dr. Suhas. He's very active in publishing and in editing our IMA D4D news bulletin on a monthly basis, which will soon become a quarterly magazine. Dr. Suyash Ambekar, thank you for joining us. He's a first-year resident in medicine working in a government hospital in Mumbai. And I believe he was on COVID duty for the last few months. And now we'll hear from the horse's mouth, so to say, his experience of how it has been so far. And of course, he will be talking about other challenges that resident doctors face, where small changes could make their life easier and less stressful. Thank you for joining us, Suyash. Welcome, Dr. Simran. She's a very smart intern who's also the National Secretary of our IMA MSN network. The Medical Students Network was also an initiative started a few years back, and it has built up very quickly to have membership from most colleges across India. And she works very hard to get the voice of this Medical Students Network brought to the attention of those that need to hear her voice. And today, she'll be sharing some of the information she has collected by doing a survey from across different medical colleges. And let's see, together we'll, I'm sure, figure out some solutions to many of these challenges. And every small step that we take in the right direction is an important step. So welcome, Simran. And our youngest speaker today is Miss Riya Sharma. She's a second-year medical student, and she joins us from Delhi, I think. And right now, she is doing her classes online, a very unique experience that none of us had when we were medical students. And she's going to be telling us some of the important areas that she feels are very challenging or stressful to medical students in first, second, and third MBBS, and therefore bring it to attention of this panelists. What are the possible suggestions and solutions we can offer them? Welcome, Ria. Thank you for being with us. Welcome to all the participants who have joined us from different parts of this country. Senior doctors are also here. Young medical students, interns, and resident doctors have also joined us. And I'm very happy to have you all with us. And for those that could not join us today because of duties or other commitments, the good news is we are recording it and the link will be shared for many more to listen to this discussion. So Manoj, should we move on to the actual panel discussion and open it up?
Yes, Doctor, we can begin with the student speakers.
Sure. So over to you, Ria. Let's start with the youngest.
Good evening, everyone. I'm extremely honored to be a part of this panel, and I would like to highlight some of the problems that I myself have faced, and hearing from my peers that all of us face as undergraduate medical students. So, can I please get the screen sharing permission? I had prepared a PowerPoint, so it's showing that the host has disabled attendee screen sharing.
So good, you have a presentation, so we all get to see those points you put together.
So my main, the point I think I've tried to highlight in this is that MBBS students who are doctors in making are, becoming the patients. That, as we know, even in an airplane, when you're going and they're telling you the safety measures, they always tell you to help yourself before you can help others. So I feel as our job as healers, before, healing other people, we need to be sure and we need to be, healed ourselves, that we should not be facing any problems, physical or mental, so that we can help others to the best of our abilities. First, I'd like to discuss some possible triggers for academic stress. So as we all know that medical students, they are the overachievers in every field. Since the starting, you've taken up science and then, having cracked NEET and then you enter medical colleges. The fact that you're in a medical colleges itself is a, authentication that you're hardworking and you achieve all the goals you set for yourself. So when you enter a medical college, there is that pressure on you that you have been performing so well your entire life and you need to continue the streak. Because as humans, I feel we don't give ourselves the space to commit errors and to fail. Because especially in today's world, I feel all of you would agree that from our childhood, it's always been about, running the race. You have to top every class, you have to crack every exam, you have to get into the best colleges. And in that race, we forget to live in the moment and, even give ourselves time to think about how we're feeling. I have experienced this myself, that when I first entered my college and, it was such a foreign new experience. There were new subjects to be studied and I had never heard of the terms before. And, there are so many books and you don't have any, it's so confusing, all of it. So it's like this pressure to perform well and, your parents expect you to do well, the professors when you enter. So there's a lot of pressure and, I think almost when my first year ended, I stopped and I was like, am I really, I've been working like a machine. I get up, I go to college, I come back, I study. I haven't given myself any time to think about how I'm actually feeling. And there is also a very real fear of failure. Because as I said, we've always been the best, at what we do. Because anything less than the best is not acceptable to us. And because we've set that standard for ourselves, that's what our parents and our teachers expect out of us too. So when you enter into a new world such as a medical college, and there's so many foreign things, you're whatever said and done, yes, we are doctors in making, but we are also young adults. So, you're making new friendships when you enter college, you have sort of inhibitions that, what kind of a person do I want to be? Because I think everywhere you go, every person thinks that, I can reinvent myself here. So, you go there and you have apprehensions, you form new friends, you break away from those friends. So all of that, and, especially that, yes, our focus there when we go is to study. So there is a lot of, what I have faced personally is that there's a lot of confusion regarding the study methods. Because for a very long time, it takes you time to familiarize yourselves with the subjects and, decide what books you want to follow. And no clarity as to how you're expected to attempt the exams in the required pattern. So by the time you figure all of that out, there are a lot of tests, and because also one more thing I feel is that there are a lot of frequent examinations which sort of don't give you the, and there is the time management skills amongst at least me and my peers, as I have seen in my college, was severely lacking. We did not know how to manage our time and to prioritize time for self-studying, because I think all doctors know that, going forward with your syllabus is not the only thing that matters. You have to go back and keep revising your topics again and again to actually, remember them. And I think all of this stress also leads to a lot of sleep deprivation, which can also manifest as other disorders. Like, I remember in my first year, I had never had migraines, and I started having migraines so often. So, migraines, anxiety, in severe cases, students may even, fall into depression. So it's a very tricky slope to manage, like the medical school when you enter. And also there are certain triggers for emotional stress that, when students enter into a medical college, yes, they are all, studious children, but we also come from a lot of varied socioeconomic backgrounds, different family backgrounds, which need to be taken into account. That, yes, as a person in a medical college, I'm existing as a student. My purpose is to study. But there are a lot of also interpersonal conflicts I'm undergoing, problems at home maybe. And, at this age, people are in relationships, forming new relationships, whether it be, just friendship or romantic. So all of those problems, you're also going through side by side. And harassment by seniors and faculty, I feel that harassment by seniors, as in the form of ragging, has been, severely stopped. I think all of us will agree, at least in my college, because of the severe guidelines against ragging and, the anti-ragging committees that sit in every college. But I feel the faculty still goes unchecked as to picking on students. That, there is a very fine line between guiding and scolding. Yes, as professors, they do get to scold us and set us straight. But when that area goes into, picking on a student unnecessarily and affecting their mental health, that is something that is not talked about enough. Because I'm speaking from my own personal experience. In my first professional, there was a teacher who picked on me so much for no reason. And it absolutely destroyed my self-confidence. I felt I could never do well in her subject. And, it just took one more professor who had faith in me and, who was like, yes, you can do this, and who helped me through it. And, just with that one teacher's support, I scored very well in my exams. And I feel if one teacher's faith in you can do that, I think if all the teachers could, help you make you feel that, yes, you can achieve it. There's no failure as such if you don't do well in one test. It's all about the long run, because you have to become a good doctor. You need to have good knowledge for that. And as a generation, I feel we have a severe absence of well-being practices, because as it is, we are so overworked. We have colleges, and then we have frequent tests and everything. And with the advent of social media and Netflix, all of our free time goes into that. That's what we think of as leisure, or, like going back into your spaces, watching Netflix and, being on social media, that you don't give enough time to yourself to, just sit and be by yourself and just think about how you're feeling, or like, actually assess the problems. And there's a lot of, coping mechanisms that, like, I remember I broke away from my friends group after my first year. And for a long time, I was not bothered by it, because, I just withdrew into myself, and I would just watch Netflix, and I would be on social media. I would talk to my friends from school. So there's a lot of space for us to go into that without realizing that, we're not dealing with our emotions. And I have, thinking about all this, I thought that I could share with you a few solutions that I think would help, specifically the problems that I have seen myself and my peers face. Is that when students enter a medical college, they really need guidance. They need guidance as to how to study these new subjects and how to attempt these exams. And a lot of the books that we are prescribed in our colleges are the same for MBBS and MD students. So I'm studying pathology. This year I have pathology as a subject. And me being an undergraduate student is studying the same book, as a as a student who's doing MD. So that, you know, there is no line between, okay, this is what I need to know and this is, you know, for further studies. So I think that really needs to be dealt with. And psychological support system is like something that I feel is really needed in medical colleges. That, you know, we are doctors, we need to destigmatize this, and every medical college is, you know, affiliated to a hospital. So in those hospitals you have psychiatrists. So I feel there should be some required monthly counseling for every student, whether they want it or not. Because the thing is that without even realizing it, sometimes you're in such a turmoil, emotional turmoil, and, you know, academic turmoil, that you just need someone to hear out your problems. And, you know, sometimes you may not even realize that, you know, you're withdrawing or you have an anxiety disorder. And, you know, so I think that that would really help. And the professors, I think, would make the most difference. I think if we, you know, educate the professors and the assistant professors in our colleges as to how, like, to increase their listening skills and to provide psychological support. Because I think even the professors can just make such a difference, because we are all staying away from home, and, you know, we sort of look up to them as our our mentors, and, you know, as like ideal figures, like how, you know, we try to emulate them, and, you know, we really look up to them. So I think if they could just, you know, be a bit more sensitive, I feel is the correct word, towards, you know, people's emotions. And just simple things as like not picking on students in class for no reason and making them feel worthless and berating them endlessly. I think all of these things could really help in, you know, helping improve the mental health of medical students.
Thank you so much, Ria. You really are a very articulate young lady. And I'm so happy that you are so open in sharing what you have faced and what you've gone through in your young life. You've been in medical college for just the first year or so, and you have faced very real challenges. And you've also represented other challenges that some of the other students will have faced. And probably many others don't even speak out. And yes, I hear you, and all of us here are listening, and this message will also get heard by many more. Thank you for sharing. Stay on our panel. There'll be other questions coming your way later. Okay, let's move on to our next speaker, Dr. Suyash. Dr. Suyash, we'd like to hear, we got an undergraduate perspective. Let's hear your postgraduate perspective and your experiences, and share some of the challenges that you and your peers are facing in the past and even now with the COVID. Over to you, Suyash.
Good evening, everyone. I'm Dr. Suyash. I'm a first-year resident in internal medicine, and today I would like to share some of the mental health issues which are faced by resident doctors. So, as everyone knows, residency is a tough yet an essential part of our medical training, where we get to interact with many patients and play an active role in their management. However, because of the long working hours and the odd shift timings, there's a lot of stress which is there, and this often gives rise to negative thoughts. At the beginning of the residency, you are so overwhelmed on seeing the sheer number of cases, and you are not oriented to that. I mean, in MBBS, you are never actually treating the patients, and you don't have the responsibility on yourself. So it can be a bit overwhelming. So whatever problems you face and whatever anxiety you have, it's best to open out about that and share it with others, so that it makes coping up with it's much easier to cope up with that. Here I would like to give an example of my friend who was suffering from obsessive compulsive disorder during residency. Actually, what he did was that we consulted a psychiatrist, and they started him on medication. But he was too embarrassed to share his problem with other residents, and he kept it to himself. So that was very stressful for him, because he had to keep on taking the medication in secret and not letting others know. So that added to the stress of his already existing disorder. So when he finally opened up about his problems, we were able to support. Like, unlike what he thought that maybe others would think of him as incompetent, but that was not the case. we supported him and helped him. So today is doing really well. So it's not that any mental disorder will sort of forbids you from going into residence or from treating your patients. So I think that there can't be any inhibition. You shouldn't have any inhibitions. You should just try your best. Be it a simple problem like anxiety or depression or anything, you need to open up about it and share it with your close friends and family, and if required, take professional help. There's a tendency for a lot of residents to self-medicate, which is again very wrong. So you should not take medication without consulting the doctors. Even though you are yourselves doctors, you should not take any medication without consulting the specialist.
Let me just interrupt you here. You are working in a hospital in Mumbai, right? And when you joined your residency program,
yes,
you did have some challenges with time management because of accommodation and basic support systems. If you could share what many residents go through.
Yes, actually in Mumbai, I can't generalize, but yes, in most of the government colleges in Mumbai, there's a problem with accommodation. So residents are supposed to be on call for 24 hours, 24/7. So, and they have odd shifts. But the reality is that the accommodation is a major problem in many government colleges, that even 6 months down the line, you sometimes don't get a room at your hostel. So it's not necessarily because of the management, but sometimes there are space issues and they have not really sorted out this problem. So I think they should look up into the matter so that the life gets eased and we can attend.
When you're doing these long duty hours, when you have to add commuting time or then managing a separate PG accommodation or something, and in a city like Mumbai, that can be quite expensive also. Is that right?
Yes, it is difficult. It is difficult to stay outside, especially and in the rains. I would like to point out that Mumbai has got heavy rains, so that is another factor. So even if you are staying close by, but you are under a different roof, so in the heavy rains, if you are called, then you have to going to the workplace, even though it might be close, it is still difficult. So that is
security issues also could come up, especially for women doctors, I would think.
Yes, and to whatever these existing health mental health problems are there, the COVID pandemic has only compounded them because it has created a lot of uncertainty, because no one is sure as to when it will end. Then working in a PPE was a new experience for all of us. I don't think anybody has ever worked in a PPE before. So donning the PPE and working for 6 to 8 hours straight without any water, food, or even being forbidden from going to the bathroom, that's a different experience.
So you mean to say most residents who are on COVID duty work for 6, 8, 9 hours without water, food, or using the washrooms?
Yes, for the entire duration of the duty. Actually, they have kept the duration to 6 hours, approximately 6 to 7 hours, not more than that. But for that duration, you are not supposed to have any food or water, and you can't take off your mask because of the risk of acquiring the infection.
And now, because it's so hot and humid, working with all those layers of protection and masks and all must be really challenging.
Yes, it's definitely challenging. And in a place like Mumbai, you sweat a lot also and you get thirsty. So you are still not supposed to drink water. So
right now, you've completed your duty, or where are you right now?
Actually, right now I'm in doing my quarantine. Actually, I myself tested positive for COVID, so I'm actually in my quarantine now.
So you're in a hospital as a patient now, not as a duty doctor.
Yes.
Okay, so you really had the whole experience of working in a COVID ward and now being a COVID patient. But good to see that you seem to have recovered, or you seem to have good resilience and bounce back from illness very quickly.
Actually, the fact of being a COVID patient also, that's a different experience, because you are not supposed to go near anyone. So that social distancing, I think that itself is a mental stress, because in Oxford University, they said that rather than having social distancing, I'm not talking about patients. What I'm trying to say is that being a COVID patient itself is a different experience, because what nobody, like, even when I was working in the hospital, like staff and all, they're all afraid to go near these patients. So because for fear of acquiring the infection, so they themselves feel very lonely. And when as a resident, I acquired that infection. So even though I was not symptomatic, but like everybody seems to stay away from you, and nobody wants to come close for fear of acquiring that infection. That itself is kind of additional stress factor. You can't meet your family and your friends because you might be asymptomatic carriers for all you know. Because even when I had the infection, I was not having those many symptoms, but at test.
Because the swab was positive, you were put in isolation.
Yes. So
I agree. This is an added new dimension of duty and stress, and there are a lot of ethical concerns that come up. But interestingly, currently I'm also under self-isolation voluntarily, because there's potential exposure to COVID, though I have no symptoms.
Yes. I would like to just point out that whatever problems you have, be it your COVID problems or your regular duty, I think that the best way forward is to not keep them to yourself. And whatever fears, doubts you might have, you need to share them with your with someone who can understand them, like be it your family, your friends, or whoever. And then that will help you go through that in a better way. Like
I couldn't agree more. That it's not necessary that you always need professional help, but peer support or family support, friend support, mentoring can all be going a long way in alleviating the mental distress that comes with challenges that you face. When you were first year resident and you had your first death while you were managing a case, how did that make you feel, Suyash?
Actually, that was a very different experience, because that death and all in MBBS, that seemed very, very far away. So you are never exposed to a patient and his grieving relatives, like death of some patient, and then the relatives are all most of them, they start crying, and also that is a totally different experience. So I think it's just it takes time to get used to it. And consoling the relatives is also, I think that's a very important part, because you need to how to go about explaining the death. You don't want to make them feel agitated. You want to explain to them as smoothly as possible. So I think that takes some time and some getting used to. So
I understand from our IMA survey that almost 78% of resident doctors have faced abuse from patients and relations. Most of it is verbal, but some have also faced physical abuse. So there is a lot of fear associated with having to handle adverse circumstances. And do you think your training prepares you for that?
Actually, our training, in a way, it's more of trial and error rather than some formal training being imparted. So that's what I can say, that they don't actually teach everything here, but you are supposed to work and then figure out on your own. But yes, I do agree that there have been incidents where some of my colleagues, co-residents, have been, sometimes physically being manhandled by the relatives also. So that is, yes, I agree, that is one area of concern. I don't mean to side the patients here, but sometimes it's there's a part of the doctor also that he doesn't explain in a proper manner. So I think one by communicating, and yes, I agree that that should be a part of our training where we are explained that how to communicate some bad news or how to.
I think communication skills is a very key part, and it's not taught well enough. But I believe, if I'm right, Dr. Madhuri, a module was introduced about communication skills for medical students.
Yes. In fact, the new curriculum very nicely brought out. You're just expected to learn it, by yourself. But the new curriculum, which is a competency-based curriculum, has an ATCOM module, the attitude, ethics, and communication, and a lot of time is spent on that. So I think that the teachers are also learning and putting in these things in place.
Excellent. So these are small steps that can go a long way in helping the next few generations of doctors to, let's say, come out more comfortably with the training and the skills needed to be wonderful doctors and help a lot of patients. Thank you, Suyash. Please stay with us. There may be other questions coming your way. And let's go to our third student speaker, Dr. Simran Kalra.
Thank you for this opportunity, ma'am. I started with a quote saying that carbon becomes a diamond under pressure. And I think that is what we medicos are. That if talking about emotional resilience, it is the ability to roll back even with the punches. And when I talk about punches, all of us start preparation from 8th standard, 9th standard onwards, and then come into medical college. And by the time we get the privilege to add the prefix of a doctor with our name, I think there is already so much we have gone through, and there is yet so much to explore, that the healers actually need some healing too. And that healing has to come from the mind, that is the will to heal. So if we lose that will to heal, that is where this burnout and stress, everything takes over, because medical field is such a high intensity field, I must say. So I have a survey with me, which we conducted in the last week of last month over a lot of various colleges over India. And I would like to share the results.
Thank you. That will be very interesting to know what our young medical students and interns are feeling. I believe you got responses from many states and many colleges. And so you could say this is quite a representative sample of the medical fraternity is facing with their students and in the new COVID times.
Can you see the
Yes, we can see your screen. Yes.
Okay. In this presentation, there was total number of 108 responses that we got, that covered 13,591 students. So there was a consent in the form which said that so that there was no overlapping, we decided that from one college only one student will fill the form and represent rest of them, giving a consent that whatever information he or she is giving is complete and correct information for the information purpose. So here we have around 68% of the students who filled the form were not from IMA MSN. So it also represented a huge chunk of people from other various other areas. And the highest response we got was from Maharashtra, followed by Uttar Pradesh and Gujarat. Then this was the consent which all the students had to fill. And out of the interns who filled the form, around 69.2% were working in the COVID zone or COVID wards or COVID hospitals, as we can see. Coming to the problems, COVID related problems that students gave us, one was the extension of the internship, now either because of after the COVID duty or because of lockdown. So what has happened in various states that the lockdown occurred roughly somewhere in mid of March and or the end of March. That was a time when in lot of states the results of the final year come out towards the end of March, and internship starts either on 1st April, and in some colleges or some states it starts in 1st of January roughly. So a lot of colleges were affected because due to lockdown, either the registrations for internship was not done, and because of some of the other issues, students could not reach the state for the registration because they were from other states. And because of that, the internship actually got extended or did not start only. And even after COVID duties, like in certain colleges, the students are working in COVID scenarios where after 14, they should be getting a 14 days of quarantine period. Now that quarantine period is not being counted in their internship period. and that is something they'll have to put after January or after April when they finish their regular internship period. So their internship, which actually started at a regular time but is extended because of the COVID scenarios. And going into COVID duty was not something they backed out from. They did it wholeheartedly, that if they are posted they will go. But because of the quarantine, which we cannot exclude the quarantine also, but then that quarantine has costed them with the length of their internship in certain cases.
Unfortunately, for residency and for internship, there is no work from home option, right?
Then there is a problem. A lot of students from Gujarat wrote this, that excessive number of interns were posted in COVID duties than needed. Like in some places only 2 or 3 were needed, but 7 to 8 were posted, which increased the risk of transmission. And already a lot of interns, since they were on duty, so the backup was left very less. Like if more and more interns are getting infected, so there are very less to take over the duties because 14 days of quarantine has to be there. So the turnover, or we can say the crowd, was less. Then infection with COVID-19 in the same. If I talk about Gujarat, there were in BJ Medical College Ahmedabad, in just 2 days 15 interns were infected with COVID-19. And then there is no increase in stipend in the COVID duties too, because obviously students are concerned with this matter somewhere, because stipend in lot of states is not being credited, or is delayed, or is cut down, or the TDS is being cut down. And they were to be given 11,000 in Maharashtra, but they are being given 6,000. And there are so many already existing problems with stipend. And above that, students are also having issues with, like, there are so many other areas which are seeing increase in the salary or increase in the stipend during the COVID duties, but something similar has not come up for interns. Then also students wrote that there was no fresh mineral water and supplies in the peripheries. And I have come to know with some students that even the sanitary supplies were finished in certain areas during the lockdown period, and they could not actually access those.
I understand, I hear you, and I feel for all those who are having to face all these challenges. I'm sure it's distressing, but since this is not just for COVID challenges, if you could move on to the broader picture and share other areas which are leading to emotional stress for medical students.
I'll just finish quickly with this slide and move on to the non-COVID related problems then. These are non-intern related issues, like lagging behind of course. And then there are students who are home and they have lack of books and study material because they left them in college. Then they are trying to access e-books, but they are not available in latest edition. They are going for the online classes, but the classes are not being conducted in various colleges. No demonstrative classes are there. There is eye pain and headache with continuous exposure to the screen. Then low internet connection that affects their Viva and exams. There is no clinical exposure at home.
That is a major area of stress for students, because the learning has to be hands-on with actual exposure to clinics and patients.
Definitely, ma'am. Talking about a first-year student, how is it possible to know anatomy if the person is not exposed to it through and every day, like in the section hall, like we are given a chance, a hands-on on it. If a student is not given a hands-on, then how is the student expected to give an exam? Then also talking about exams, it is a double-edged sword right now, because if the exams are delayed, there is delayed promotion. But if the exams are occurring timely, then there is no proper clinical exposure, and there is rushed online syllabus, which is piling up the pressure, which is going to pile up the pressure in subsequent years too, because if the foundation is not right now.
So these are new fears and stresses on the academic front that first and second year students are facing.
Yes, ma'am.
Okay.
And then the internal assessment, most of the colleges state that 50% is needed in the internal assessment to move on to actually sit for the final exams. But if the internal assessment is not being carried out, which also includes the practical, then that is also confusing for students, because no new circular has come, because that what will happen with that internal assessment. Is there any change, or do they still have to go for it?
Again, communication and clarity would help them to understand the next steps.
Yes, ma'am. Ma'am, and talking about fees, there are certain private colleges which are demanding excessive fees even during lockdown, which is adding burden to the parents too. Then non-COVID related problems, if we talk about in the interns, it is about stipend, which as I already mentioned. Then about recognition, there are certain colleges. If I talk about Haryana, the SHKM Mewat College is not recognized. So they get recognition on conditional basis, and the institute is also asked about to make certain changes. Only then they'll be given recognition, but no such similar change has been done, which also puts students under a pressure that what should they go forward with. Then registration, like in Delhi Medical Council, the provisional license has not been issued to the students because it has students have done registration in March, but there has been some delay, which is already putting away their license. Then supplementary exams. This is again a scenario like there are certain students who are yet to give the supplementary exams for final years and other profs, but there has been no circular about the same, obviously because of COVID. And when I talk about all this, it's like students are home, they are locked down, and they have nowhere to go. They have all this stress piling up. They don't know what to do. Exams, when will they occur? There are so many thoughts going on in their mind, I'm sure. And they might be, because of the pressure at home, and everybody, because parents also expect them to go forward with the studies and not hold back because of the lockdown. They are actually turning to various, let's say, coaching institutes and online studies and everything to somehow cover up, and still landing up with anxiety about, because they don't know what is going to happen tomorrow. So I think in a scenario where the students, yes ma'am,
the uncertainty is really a challenge.
And in today's time, which has actually become too much of a screen time, students are juggling between their screens, I'm sure, and preparing for exams that they don't know when will happen. The COVID has been a cherry on the top for them. And if there, the only thing concerned here is that there has to be somebody looking out for them too, because they are going to be looking out tomorrow for the health of the nation. So we should do the right thing today so that tomorrow the health is in the safer hands and it is not just gamble like this.
I couldn't agree more. You have stated very valid points and stress areas. And I agree completely that online learning is not the same as face-to-face or practical hands-on training. Like, let's say right now, there's a plus to having this webinar where a lot of people from across India can join us. But it's not the same as having a big auditorium where you actually have the energies feeling, and when something nice is told, people will cheer or clap. You get all those feedbacks and you get all that enthusiasm and you get all that energy that comes with people being together. I agree. Online learning is not completely going to be able to replace face-to-face learning. But let's take one step at a time and we'll figure out.
Yes, Dr. Nilima, in fact, I think we should, when we get into the panel discussion, discuss a little bit about online, because the reality is it's going to stay here and we have to really find a solution to it. And we would love to hear from the esteemed panelists on that topic. So with that,
thank you, Simran.
Yes.
Thank you, Simran. Please stay with us. There might be some questions coming your way, and we will look forward to hearing more from that data that you have collected pan-India. Now let's come back to our panelists. We have Dr. Madhuri, we have Dr. Sandeep and Dr. Suhas. Dr. Sandeep and Suhas, being psychiatrists, will give us more of the review of what they've heard from the students and what they interpret it as. And Madhuri and myself will probably be giving the perspectives that we have observed after hearing all these three students. So over to you, Dr. Sandeep. Can you summarize where you feel are the biggest stressors and emotional challenges that our medical students, interns, and PGs are facing after having heard the three representatives here just now?
Yeah, I must thank Ria, Suesh, and Simran. They took me back 25 years, Ria, and then about 20 years ago when I was a student. In many ways, things haven't changed, at least some of the challenges. COVID is a completely new challenge. I would like to probably take a longitudinal view as well as a cross-sectional view. My professor, my guru in psychiatry, he made a very pertinent comment, and he said, every generation goes through a very unique challenge. And I think we are seeing this situation after 100 years, after the Spanish flu, Spanish pandemic. So everyone is running helter-skelter. They are holding online classes for primary school students. We don't know how everyone is going to cope. Taking a broad longitudinal view, I would like to say that in the corporate world, when they talk about stress management or resilience building, they have an acronym called TTI, the team, the task, and the individual. So at a much larger level, I think this did come up in Dr. Simran's survey. There are things that need to change from the curriculum level, and Dr. Madhuri highlighted that new modules are coming. ATCOM is a welcome change. Then at a larger team level, I would also say that change needs to come about from the individual states and medical universities and colleges. I can quickly bring in the example of what Government Medical College Ballari did. Peers got together and they started a listening group. Students could write in. Technology, all of the youngsters are far better than us, so they know how to use it. Then coming to the task or the activity that we do. Well, here, while I was preparing for this webinar, I came across a systematic review by a group from Taiwan, and they found out that burnout rates are no longer happening for seniors or people who have put in 10 or 20 years of clinical work. Depends on which survey you take, between 10 to 70% of medical students and residents have reported burnout. So things to help them would be a good selection of the specialty and the subspecialty, a good match between the personal skill set of the individual. So Dr. Suhas will talk a little more about this booklet that IMA D4D has brought out in collaboration with the White Swan Foundation. And in it, we did talk about, the transition for someone like Ria, who is making a big jump. How do you cushion it? How do you, understand? We do have a section on, study skills and time management. So,
you mentioned burnout being very high and very significant among young medical students and PGs. And as I understand, WHO actually gave it a disease entity status last year with its own ICD code and everything.
Absolutely. The new ICD, the ICD-11, is going to qualify burnout as a condition. And since you asked Dr. Nilima, let me quickly define that for our youngsters. It's a triad of feeling exhausted, mainly emotionally, having a depletion of energy. And then there is, we use the term depersonalization, but in simple terms, it means distancing from work, having negative feelings about yourself and the work, developing a sense of cynicism. And it was quite alarming to hear that some survey that was published recently, a month ago, which said that medical students want to quit the course. So I suspect burnout had started there. And the third element of burnout in the triad is reduced efficiency. So, task and then the individual, TTI. So at an individual level, one needs to, skill up, whether it is for the academic activity. And just to respond to, one of Ria's statements, that one doesn't know how to navigate. There are about 23 odd subjects. Each of them is a different animal in itself. So one needs to learn how to tame it. How do you go through the nuances of it? I hope none of my seniors from medical school are listening to this. I found out that there's a lot to learn from those who have failed. So I used to go to them, find out what is it that they did not do well. And that helped me sometimes.
That is very true, Dr. Sandeep. Actually, we learn much more from our failures than from our successes. And
True.
accepting that at some time in life, things will not always be hunky-dory or not work out for the best. And preparing for the time when you may be failing and how you will learn from that and bounce back and be resilient and grow stronger is also an important life skill, not just for medical students and not just for academics, even in your personal life, right?
I couldn't agree more, Dr. Nilima, because resilience is not just feeling good at all times. I mean, that's difficult. It is accepting that it is okay to feel bad sometimes, that we
Right.
have, such a challenge in front of us that we try to nudge our way and develop positive adaptations to negative events. I'll quickly finish with a little bit on the individual skilling up.
Yes.
I would like to imagine that we all have a toolkit, tools for how to deal with difficult situations, tools that help us in our academic work. For example, Dr. Suyesh was talking about skills of breaking bad news. So that's something that can be learned and it can be taught. Skills of how to develop empathy towards your patients. The Indian Psychiatric Society is also working tirelessly to try to get recognition to reducing stigma or improving access to psychological health. And one last thing I would say, if you pick up any stress management book, they broadly talk about being aware of, what is your boiling point and what stress are you okay with, the eustress or the good stress. At what point do you call it as distress? I would urge every one of us here to learn at least one relaxation technique. In addition to hobbies and interests, a relaxation technique would be, yogic practices. It could be meditation. It could be learning deep breathing. The buzzword nowadays is mindfulness, though it's a new concept, but the essence of it is thousands of years old, goes back to the Buddha, wherein, thanks to Ria for again reminding me of mindfulness, because in simple terms, it's the mind monkey. There's a monkey sitting in our minds, and the monkey being a monkey won't just stay in the present. It either takes us to the past, that last duty which didn't go well, or that patient who unfortunately succumbed. So we need to accept it, we need to learn it, put that learning into our practice. Don't get too worried about the monkey jumping too much into the future. I've heard students who are in second MBBS who are already planning on the entrance exam, let's say, for post-graduation. It is okay to plan and prepare, but don't get too worried. And I saw some messages. Let's not be despondent. Going through the grind of MBBS and becoming a doctor, it's a wonderful opportunity. So yeah, I think I've given a longitudinal and a cross-sectional view. Dr. Nilima is in the dark, so I'll leave it with you.
No, I'm feeling enlightened now with this light.
Sure.
So let me give you an enlightened quote. It says, the past is mystery, past is history, and the future is a mystery. The present is called the present because it's a gift.
Absolutely.
So
Absolutely.
I think we should all value what we have right now and not worry too much of what didn't happen right in the past or what may go wrong in the future. Accepting that things will go wrong and knowing how to deal with that and learn from it is what resilience would all be about.
Yes.
Thank you, Dr.
Yes.
Sandeep. Please stay with us. Dr. Suhas, I would like to bring you in because in the book, I think you have authored that chapter about early signs of distress and burnout and mental health challenges developing and how to identify that in oneself or in one's peers. And then, of course, what to do about it once you identify it. So can you please share your thoughts on this topic, Dr. Suhas?
big congratulations to all our student speakers. That involves, I think, Ria and Suyansh and Simran. I think, I mean, they've been very, very brave to come across into a forum like this and to be so lucid and transparent about all those issues they face in the ground level. None of those issues are from research papers, meta-analysis, or from Western textbooks, which is what was most pleasing to hear their version. It is unique to India, it is unique to our culture, and is unique to the practice that has been going on for more than 100 years. So hats off to all of you for that. So the question that you asked, ma'am, in terms of how do you identify stress, burnout, and sort of what could be the markers or the red flag symptoms? I think it can present in different ways. I think we should not be under the illusion that it presents exactly the same way in every person. Whether you are a student, whether you are an intern, you're a resident, you're a doctor, it can present in different forms, and we need to be aware of that. Or rather, I would use, we need to be mindful of that. So, for example, sometimes signs can be very subtle. It can be both psychological as well as physical as well. In terms of psychological, I mean, your mood might be low most days. You might lose interest in things that you were previously interested in. There might be an undertone of irritability, things that are that did not irritate you in the past, something that seems extremely trivial to you. It might work you up to the extent that you end up having fights with peers, with faculty, or with parents. Biological functions, including sleep, appetite, might find it difficult to fall asleep. Sleep duration might be reduced. Your appetite might be a problem. So it can present in different ways. And even sometimes a lot of students, because I do see and treat medical students who have not just functional issues like stress, but burnout and depression as well. Sometimes the signs are so subtle in the sense that they can just have physical complaints. Like somebody mentioned, I think it was Ria who mentioned she joined first year and she had headaches. You can have only physical symptoms, and it can be a headache, it can be gastrointestinal symptoms like diarrhea, abdominal pains, general fatigue. How much ever you rest, you don't feel recharged. You have muscular aches and pains. So there's an absolute wide spectrum in which symptoms can present. And I think Sandeep hit the nail on the head when he said that awareness is important. Even with this book, what were we trying to do? We were trying to sensitize individuals that this is a problem that can exist. Only if you are the first step, the first solution to any problem is to accept that there is a problem. To be aware how does a problem present. Only then you can go to the next step and solve it. So
and probably important, wouldn't it be important for them to also be aware that they're not the only ones? Many
Absolutely.
more are going through very similar challenges, and
yes,
it's not unique to them, and they can reach out and get help.
absolutely. Let's look at what Suyash said. He said he had a friend who had OCD, and the friend was not able to connect with anybody or even talk about it for a very long time. Now, can you imagine the distress this person must have gone through? Imagine a person having an exacerbation of bronchial asthma and you tell him not to have a wheeze, not to hyperventilate. How is it possible? Now, that must be the similar difficulty that this particular student must have felt. And look what happened when he actually went ahead and told people. People were accepting of it. So one message that I want to be very clear is sometimes the stigma exists within us. We think that people will react in a particular way, but actually people will be supportive. He also mentioned how important it is to share stories. All of us need to share our stories, whether they are doctors, senior doctors especially, to tell that, you know, when I was a student, I experienced this. A lot of junior doctors and students feel very lonely in their experiences. And if they can hear senior doctors who have gone through the struggles and now thriving, to hear them talk about it can be therapeutic. You know, it is really helpful. So please remember, with sharing your stories, people's hindsight can be some other person's foresight. And I want to be very clear about it, that you might actually be saving a life. The more open you are with this, you have no idea the ripple effect of it and how helpful it can be for students. So these are basically—
Just a pause here, Dr. Suhas. Since what you're saying and what some of our student speakers said, we want people to hear us. They want to be heard. They want to be listened to. And even if you can't immediately correct the problem, the fact that it was heard and it was empathetically heard helps you cope with it. So perhaps IMA D4D could have a webinar like this to create a platform for sharing stories, good, bad, and ugly, and just sharing sometimes relieves the distress.
The best medicine is listening. Listening has a medicinal value that sometimes even the best antidepressants cannot match. And it is important to know that you are not the only one out there going through that similar experience. There have been people who have suffered the same problem and recovered from the problem, that there is a solution available. These are people who are in the same shoes as you are today, but they have gotten better and there is treatment available. And some stigma or myths that exist have to be debunked, in the sense that people think the only treatment for depression and burnout is antidepressants or medications. There is therapy available. It's an evidence-based treatment. There is cognitive behavior therapy and other therapeutic principles that are available. So I think that it is extremely important that students are aware. And like you said, listening, it need not happen only with a psychologist or a psychiatrist. It can be a mentor. It can be a peer support that you have. Student counselors, a lot of medical colleges, including the one that I work in, have a lot of student counselors. And listening is something that they can also do, because it is catharsis, it is ventilation at the end of the day, and it is definitely going to help. So I think you hit the nail on the head. Listening should come first, then comes the medication and the diagnosis.
Thank you, Suhas. Please stay with us. And I would encourage all listeners to download a copy of the MBBS Survival Guide. And a lot of very specific tips are there. Read it, pass it on to your other colleagues and friends, especially the young medical students and PGs who are listening in here. I would like to bring one more aspect of emotional well-being and resilience, and that is having fun in life. Even when you are surrounded by disease and death and distress and disabilities, it doesn't mean that you have to be completely serious and completely somber and pulled down and sad about everything that's happening. You have to also look at the brighter picture. Just like the media is highlighting all these COVID issues, but they should highlight that 90%, 95% are recovering. 80% don't even have many symptoms. 90% don't even need to be in a hospital. And those who are actually already ill with other diseases may succumb if COVID gets added. But they highlight only the negative aspects of the large numbers. So having fun and having ability to laugh and smile is also important. So I would like to bring in Dr. Madhuri here, because I remember she had spoken once about a fit mind in a fit body. So Dr. Madhuri, what would you say were some of the measures that were implemented when you were the dean at the Armed Forces Medical College that really helped emotional well-being among the students?
Thank you so much, Nilima. And again, like everyone else, I'm really thankful to especially Simran, who did an amazing analysis and a feedback from so many students, and Ria, who, I mean, she sounded like that first MBBS student when I felt the same. Ria, don't worry. I'll start by complimenting you by saying that I joined AFMC and felt like took Nilima's thing very seriously, like, you know, a child who gets into a toy shop and suddenly has everything there. So there was, you know, getting into a top college, and then you had the sports and the dramatics and everything. And I had I'll share honestly that I really had a nil ke barabar attendance. I failed in my first part exam. And I don't think even Dr. Nilima knows who's my sister, by the way. Yeah, but then, I got was so scared when a letter went home, and my parents wanted to know, was that why I wanted to join medicine? So I said, no, I want to become a doctor, but I also want to have fun becoming a doctor. I think that is what I would share and reinforce. And that was the first time I learned the lesson of time management. And I think that is what I would like to share with all the students here, that life is about time management, and the sooner you learn, the better. And nothing like a medical college where you're pulled in every direction and you learn to prioritize and you learn to do that time management, because you need that as a doctor. You need that to balance your personal life with this, and you need to balance it to have fun also. So I think you learn your lessons while doing this. That's one thing. And this now coming to your specific part of in college, the things which AFMC has a little different environment, because it's 100% residential. So it gets a little bit like the Gurukul environment. So there were things which were happening, but which I really stressed on was this whole thing about a fit mind in a fit body. And I think today a lot of students get so stressed with this, they don't find the time to do, but actually you have to just make the time. Time is there. I mean, if you see and you say 24 hours, you have eating time, sleeping time, studying time. I don't know why you can pull out, if you want to do it, you would pull out those 35, 40 minutes at least, and at least 5 days a week. So we start with little, PT or something in the morning and even the youngsters, there would be a few AFMC kids also who crib in the beginning, but then they realize that it's so important to get out into the ground, have those games. Evening we have games, morning we have PT, and after that, even if it's not compulsory, we encourage students to do just that. So I started by telling that we have so many clubs and societies. Please join one which is outdoor, which is for your fitness, and join one which is something that you find relaxing. It could be music, dramatics, debating, whatever, or something you really wanted to learn, because look at the stress. I mean, Ria, I really relate to that. I've been sitting for 5 years on the interviews, and I feel you kids are a total different because of the pressures. You know, when you have those horses which go with those little side, they can't look right or left. When I would take interviews at AFMC, I found students who didn't know anything other than, because after 9, 10, they just became bookworms. They mugged, and then they took a drop, they did coaching classes, and they got into a medical college. I mean, what's there about life? So I think it is very important that you have to keep your, these things, and it's not everything that is there in the books, and marks is not everything. Fine, if you're topping, you're coming first, but otherwise, I remember Dr. Nilima will say, my youngest sister would say, okay, so what about if you come first, fine, but if you pass also, you go to the next class, right? So make sure that you do that. Right? I mean, you're not going to get and finish your, after first MBBS, you're going to get out at the final MBBS.
Like all the wise people say, it's not about the destination. It's the journey that you should enjoy.
Absolutely,
so that
absolutely.
it makes it meaningful.
Absolutely. So therefore, I think this time management, taking time for play and some kind of an activity, retaining your hobbies. And it's not about medical college. Those hobbies are what's going to take you in life ahead as a doctor. I mean, even today, if I'm stressed, I still go and do some yoga. I go and play golf. I might go and do some riding. I might do something or the other, because, and I'm still energetic at this nearing 60, because, it's basically that you can come back from work and say, okay, I'm going to do this. So it's about an inner energy which is required and a self-motivation. Finally, you have to derive these and cultivate the art of this through various. But for that, you need something. And I always love people may have heard it on some of my videos, but I said, for the younger generation which is lost, what would we do? We would look, we had this thing of opening a big book and looking at a map if we wanted to find our way. Or we would, if you're driving, you say, ye rasta udhar jata hai kya? Because there were people around. But what do? What does anyone do? Ria can tell me? Or anyone from that matter over here? Google. Google Baba is the answer. A map. So, right? So when you're lost, what do you need? You need a map. So all this generation needs is a map. And my definition of map is a little different. My M stands for a mentor. So I think, like what was already pointed out, so I brought in that in AFMC. It was there, but I put it into a structured vertical tree pattern, wherein you had one faculty with 2 students each from each, and they formed a family. So you had from every MBBS you put in 2. So there was peer mentoring. I didn't expect the teacher to snoop around and interfere in the lives of the students, but they knew that, like, he is the big brother or whatever, someone I can talk to. And I would say that, yes, at least once a month, get into an unstructured meeting. It could be at the students' cafe. The faculty could call the kids home, or kids could organize something like, okay, let's do this. So it was that. And I just kept a thing on as a dean as to whether that was happening. So, and I got a lot of inputs. And parents would, because it was a residential, so parents had one point of contact in the college, and at the faculty itself was, if a student wasn't performing well or something, would look into it. So this was one thing which I started. The second I thought was for my map. I go back to my map. The A stands for attitude. I mean, you have to change your attitude, right? You can be browbeaten, you can do anything. Are you going to be that glass ball which is going to be cracking when you throw it down? No, you're going to be that rubber ball which is going to bounce back. And that
bounce
resilience.
back higher.
Yes, absolutely. So that attitude has to be cultivated by you all. We'll come to specific measures later, but I would tell all the students and help them along by, we started a system called a buddy system. So there was either a person from your same place or someone from your same this. So the whole batch was divided into a pair share kind of a thing. So you were accountable not for yourself, but you knew something what your buddy, if he was unwell, there was always that one person who was, we would sort of, if there was issue, the person need to or the faculty need to contact. So there was that buddy system. So and created a positive attitude with fitness and an ability to think, I think changes your attitude over time, because everything is not genetic. Environment and how you adapt to it and how you are surrounded by brings a huge change in your attitude. So that's important.
If I may just interrupt here,
yeah.
They say attitude of gratitude really makes life good. Because
absolutely.
If you can just think of a few things that you can be grateful for, it could be something very small or something very big, but there's always something that you can find to be grateful for. And when we are full of gratitude and positiveness, you find it's not important to complain about every petty thing that's happening.
So let me put that one in perspective to all the students listening. What is it, the biggest positive attitude to be grateful about COVID? You're neither a kid, you're neither above 60, and you have no comorbidities. So you're going to be in that 90% who's going to protect people like us, and you're going to be the giver of that herd immunity. So three cheers to that. And I'm very proud of you all, right? So I think that is attitude. And the last is P of your map, we go back to, is the passion. You have to be passionate about, even if it's sort of, if you're going to just do it for completion, you're going to read that or attend a class because you have to finish with it to give an exam. It's not the same as if you're going to make it fun. So that passion in whatever you do, if it's making a slide, it's amazing. And I was amazed with the passion that came across, whether it was Ria who took time to come out and the doctor said in front of all this huge thing to come and speak on your behalf, or Simran who went into every detail of so many colleges. I was so impressed. Way to go, girls. And Suyash, your passion to go back to work in spite of coming out of work. I mean, it's there. So what I want you to do is ignite your own, find out what is it that ticks for you. What is it that goes for you? I mean, even if I'm talking, I'm sure I'm conveying to you the passion that I have in just interacting with students. I just love being with you all. So I think that is the spirit. So that was the map. And I will further this thing by, I told my students, and then I put in a counselor and I gave a helpline. And I put that in such a way that they could approach her besides the thing. And I told the counselor, I don't want to snoop on. Students should feel free to tell you. But if there's a red flag, please come and tell me that this person is, and I'd like to help. So this is something, these are some of the few measures that I put in. But I think you kids are way ahead of us in technology, in adapting, in having this thing and going on for all the information. So just go ahead with your map. Find yourself a mentor, get yourself that attitude, bring out your passion, and you will do great.
Thank you, Dr. Madhuri. And so we have it all mapped out for everybody now.
Yes, Dr. Nilima, we have a lot of questions here, and we also may not have time to really cover the questions that we had planned for the panelists. But, one of the things that comes to my mind is that while on one hand, we're telling the students about the need for, and this very powerful inputs have come in from the three panelists for the students, how do they really try to address the whole worry animal that is sitting on their back and now there are mounting worries of various kinds. We have heard about all those new worries that from the 3 student speakers also. How do they begin to say that I'm mindful of the worry? I have to offload the worry and begin to pick up those nuggets and advices that I've listened from the 3 panel members. And they're very valuable inputs. That's something that I think it will be nice to address, so that we not necessarily get into each of the specific worries that there is a long list here in the questions. But on a general way, I think we should be able to tell the students as to, it could be any worry. 3 months down the line, it could be a whole new set of worries probably, So it's not specifically how do I solve my online class problem or how do I solve my other problem. So I think it will be nice for us to help them through that exercise.
I will ask Dr. Sandeep to speak on this, but just before that, I'll share a thought. Putting that worry into perspective and not allowing it to become all consuming would be the first step, according to me, as a lay person, and how I deal with things. But I'd like to hear what Dr. Sandeep has to say about it.
Sure. We actually have a definition for worry in psychiatry. We are good with terminologies and labels and whatnot. So worry is a round of painful thoughts. So if I'm not able to log in today, and if I keep thinking about it, that becomes a source of worry. No, I have still yet to recover from Dr. Madhuri's map. And ma'am, I think you just compartmentalized it so wonderfully. So thank you for that. It makes Suhas and my job easier. See, it's imagine a pyramid way of looking at this whole thing. The big base of the pyramid is probably all of us in the medical fraternity. All of us need one tool or the other. All of us need some sort of mentoring or the other. There are specific ways of getting around. For example, there is something called as the Balint group or the Schwartz rounds. You can Google them. These are ways to get peer support and create opportunities for one to talk it out. Going back to Suyash's question about how to deal with grief and death of your patient. So things like the Balint group or the Schwartz rounds would help. Then the top bit of the pyramid, I'm not talking about the peak of it, would be probably 10% of us or 10 to 15% of us who are likely to have common psychological problems. By common mental illnesses or psychological problems, I mean difficulties getting adjusted to change. Change is ubiquitous. The only thing permanent is change in medicine. You either keep moving from one subject to the other, or the way you practice medicine is bound to change. The way clinicians are now practicing with all the teleconsulting happening, that's a huge change. So that is where things can go a bit skewed, be it conditions like anxiety disorders or depression. Feeling low and feeling depressed, there's a big difference. We all feel sad. That's normal. Depression would be 2 weeks or more of feeling low continuously, losing interest in things, and symptoms of fatigue.
So
that is
burnout can move into depression without you realizing it.
Yes, Dr. Nilima. So if adequate steps are not taken, burnout can move into depression. So that these 10% of people probably need to see a mental health professional, whether it is a psychiatrist, a counselor, or a psychologist. And I did see one of the comments where it was mentioned that taboo and stigma is more in India to see a psychiatrist as compared to the West. Well, having spent about a decade in England, I can tell you stigma does exist even there. It's getting better, and you can be the change maker. So it is okay to go talk to a mental health professional. Perhaps the top, less than 1% of the tip of the pyramid are the serious mental illnesses. the severe mental illnesses. And this is where one needs to most definitely identify. It could be a colleague of yours, a friend of yours, or it could be yourself. Things like bipolar disorder or schizophrenia or severe addictive disorders, then suicidal thoughts. I mean, it pains to hear when I was in MBBS in a government medical college, every year we used to lose a student through suicide. The one that stands out for me is a girl who had just joined MBBS and she failed in her first internal assessment. She went home and hung herself. Or the long suicide note that was left by one of the anesthesia PGs, I think a year and a half ago. It is painful to read that. So it is important for all of us to be ambassadors, all of us to watch ourselves as well as people around us, and definitely not hesitate to seek the adequate professional help.
Very well said, Dr. Sandeep. And whereas in your time and my time, we used to have one odd case in a year, ever since I became the chairperson of this Doctors for Doctors, every 10 to 12 days, I get a detailed report about another suicide. And it's really sad because I believe it's a preventable cause of death. If timely identification of the underlying causes or the mental distress is there and healthy coping mechanisms are built in or treatment is given, it can definitely be prevented. So I would like to ask Dr. Suhas about what are the common coping mechanisms that he has observed among students in his experience as a psychiatrist attached to a medical college. Unhealthy coping mechanisms that are frequently resorted to, and what would be the healthier options? Dr. Suhas?
Before I directly answer that question, ma'am, I'll just add on to what Sandeep said and to Manoj's question on worry, how it's a constant thing on your back. And, students are always worried. And the shortest way to put it is that there are only 2 times in your life that you're not worried. And one is before you're born, and the other time is when you're die. So other than these 2 times, the entire journey from the start to the end, there's going to be worries. It's inevitable. But think of dealing with worries like how you deal with any other skill. Think of the first time any of you drove a car or drove a cycle. It was not perfect. I'm sure when I took out my car the first time, there were so many dents in it. I almost killed a dog. I almost hit a person, so etc. But the more I did it, the better I got. I got with handling it. The anxiety decreased. So coping skills and handling worry is just like that. It takes practice. There might be 10 and 20 different methods that you can use, but find that one method that works for you and practice it, and you will be able to handle that worry. And then it doesn't become a wolf on your back, it becomes a small puppy on your back. So it really is a matter of perspective and how you want to see the worry. So number one. And number two is coping mechanisms. Yes, I have seen a lot of students use both healthy coping mechanisms and unhealthy ones. One of the most worrying unhealthy coping mechanisms is social isolation. They choose not to interact with anybody. They skip classes. They don't have sessions with mentors. They don't meet the student counselor as required. They just get withdrawn and they go into a shell. That is one. Attendance drops. Number two. And also substance use. I've seen a lot of students cope with any sort of stress, burnout, and just exhaustion, any form with substance. Some of it is to deal with myths that using a substance will somehow improve your concentration levels. It will make you more energetic. Not true, definitely not true. As in on the long run, the harmful effects can actually be a threat to your life. So substance use is a very unhealthy coping mechanism that is prevalent. Number three is to deal with it in terms of displacing the anger and frustration on people around you. It could be a family member, it could be your hostel mate, it could be your teacher, stringing up conversations, fights, and constant arguments with these people is also another unhealthy way of coping. I also at times seen healthy ways of coping. For example, let's say Simran today posted that survey. It was her way of coping with something she did not understand. She was herself feeling stressed and she thought doing a survey like that will give her a new perspective on how to handle it. That is one healthy way of coping. Do something about it. engage. I know people who have engaged in well-being initiatives. These are people who have done, taken student mentoring, they have taken student self, they have tried to talk to their peers to sort of help out in any way possible. So in getting involved in well-being measures is in itself one way of taking care of your well-being. I've also seen a lot of people change the way they think about certain things. For example, I think Suyansh is the first year medicine PG. I mean, your first real definitive experience as a full-fledged doctor is happening at the time of a pandemic. I mean, can you imagine that? Your first experience will define the sort of doctors you will become. There are a lot of interns, a lot of PGs who are starting their career right now. Over the years, there have been doctors who have started their career during hurricanes, famines, epidemics. But once in so nearly... Or war, exactly, or any other natural disaster. But once in 100 years, you're starting your career at the time of a pandemic. That must mean for something. I mean, we have had where one single RNA from a winged mammal has brought the entire human race to its knees. Now, what do we do for the next pandemic? Some of these solutions are actually going to harbor in the minds of these students today. And that is because of their experience, the crisis they have gone through. And if you can handle this crisis, you can handle anything, the way that I have come to deal with it.
Yeah.
As I see it, Dr. Madhuri pointed out that they are the lucky ones who are the young, healthy ones who are going to survive the pandemic, and such a huge learning, unique opportunity that we never had. Thankfully, we never had.
There are so many things that you cannot learn from the operation theater, that you cannot learn from the best of textbooks. These are things that you can learn only from your experience. And today, the things that you will learn will stand you in good ground throughout your entire career. So I know, see, for example, Suyash, I cannot even relate or even tell Suyash I understand what he's going through. He's COVID positive, he's in quarantine. But if he comes out and has a reflective narrative of what happened rather than a traumatic narrative, that is resilience. That's how coping develops. That's how resilience develops. So even when you find the smallest of crises, if you can find a window of light in it, I am sure that light is going to guide you home throughout your career. So that is how I would answer that.
Suyash has given us an excellent example that he's there with a smile on his camera in that single room with nothing else to keep him entertained, but willing to share his experience and show that he's still willing to go on and learn from what's happened. And sharing it with everyone gives everyone the chance to learn, including us. Thank you, Dr. Suhas.
Yes.
And I would like Dr. Madhuri to add about what she believes would be the way forward in not just mapping their coping mechanisms, but in actual curriculum related skills or institutional related interventions, small ones that can give very high dividends, like some of the things that were done when she was the dean.
Yeah. I think there's one thing I'd like to add to what Dr. Suhas was, coping skills. I found one problem which people are resorting to, and I would like to guide the youngsters who are listening on, is an addiction to the net and social media. This is something that I found was happening when I sort of interacted and got in with and close to the students. There were people who were spending too much time, and you don't realize it, but it starts really impinging on your thing. So where you're trying to cope, you're trying to balance out your time, I think this is also important, and where a self-discipline of, okay, I'm going to check my messages or get in use only this part for communicating or interacting and keep it off is, I think, a very important thing I'd like to tell everyone. As far as, to take your point forward, Dr. Nilima, I thought I would, in this process, try to also address some of the points that came out from, I've been reading some of the questions, plus I've been listening to the students, and at the moment, they're really worried about what will happen. They're missing out on classes, are they missing out? And that's because we have tuned ourselves to get into a rat race at all times. Everything is about time. We feel everything should finish. It's not like that. I mean, look at this, that the whole world, if the whole world is going to write off 2020, and yet y'all are not really writing off, but you're probably going to have all a little extensions, 2-3 months, and then, yes, the online classes are stressful, but look at it that you're at least able to keep connected with people. You're able to listen to this thing. There's someone taking efforts to teach you and not sitting back and say. And also, you're a part of the new normal that we're all developing. We're going to have this and going to have to learn to live with it. So there are going to be a lot of changes. I mean, for that matter, this webinar, I'll be honest with you all, ever since lockdown has come in, I'm on some kind of a webinar every second, third day. I don't think I ever did so much of it. And yes, though there was that whole auditorium, in a different way, I feel closer to each of you because I feel I'm face to face with each one as against a whole auditorium where the last bench I could not. Here I can just change the pages and see that, right? And the rest is, I want to tell you that we are all continuous learners. I thought Dr. Vivek put up a point about being lifelong learners. I assure you the teachers are under bigger stress than you are. Because I am a part of the MEU. We were not born to teach online. We are making attempts to teach you all, to remain connected with you all. So though it's not the best, but we are also learning, and I'm sure a feedback from you all that, putting in some questions in between, or putting in some, giving that kind of, keeping the chat on, making it participatory might also help improve what we have. So instead of whining for what is not, let's try to improve what we have, and this is going to be. So I think, please don't worry. 2-3 things that I'd like to tell you all is, yes, this is not time wasted. This is a time you have been given to spend with your family, to spend, to reflect, to start using the time to read something beyond your books also, because life is learning a lot of other things. So yes, while you're reading, enjoy reading up things what is available. So keep doing your whatever 3 hours or 4 hours the classes chalte hain. But imagine you're sitting at home, you're not rushing in a bus, you're not catching a local, you're not running all the time. You have the whole day to think about it. So divide that time and use it fruitfully. I can assure you that the MCI is as concerned about you, and every few days we are bringing out new guidelines. Being on this thing, we do sit down and think of your problems where we can find a solution. The postgraduate residents, there was a problem, it was extended, but it was decided that no, we must get on, new batches must come in, and fair enough, people who have learned so much through real life, we are going to have exams for them with virtual patients and a virtual viva. I mean, have you ever heard of it? And look at the de-stressor. Suddenly, you don't have to stand in front of 4 examiners and present that long case. Yeah. Look at the positivity. So everything is happening in its own, and the organization and the system and the country is with you all. So whereas exams will be conducted, internship would, if there is a delayed period, probably the PG entrance would also be delayed. So everything would keep on getting adjusted and a little telescoped so that we can fit in. And that's where your resilience is going to say. Can you learn? When you want to, you can learn the same thing in fast forward. And take this as learning experience. Use your time fruitfully. I mean, there's so much you can do in your own neighborhood. Have you thought of, like you've done, you can do a survey with your neighborhood. What are the perceptions? Do a KAP study. Start understanding how is society. It might make you also an amazing doctor who's able to empathize. It's not only about an ATCOM module. You can use this time, because otherwise in your busy schedule, you don't get. What are the problems which are ailing society? Look, when you look at the news and say, okay, Hyderabad, a doctor was beaten up. Why was he? Can I do a survey to find out what is it that's ailing society? Why are they against us when I'm trying to do so much? Can we look into that? So I can give lots of examples for you to say that there's so much that you can do. The other thing I wanted to, the MCI, the other important is, people are talking about clinical, being away from clinical. Simran here would bear with me. It's a huge concern for the education and the educationists and the deans, that why are students today not attending clinics and classes, but would rather be with DAMS or some other coaching class and are already into their PG. I mean, you've not yet learned your UG, you're bothered about the PG. Whereas if you said that, yes, the PG seats are increasing, Every year, that is what the government and the organization, PG seats are going to be increased. So you're going to as long as you study, you do your bit, learn to become a doctor, a good doctor, and enjoy that PG, develop a passion for it. It's not about just going for a coaching class and cracking the exam. So take time to reflect on this. And I thought Dr. Suhas's word was there. I think we have not taught our students to reflect. So there I will tell you that now the students at AFMC, when they join in, and that form, initial what they call the foundation course has been added for that. Students are coming and parents are asking us, there is a waste of time. Medical ke liye gaye 8 weeks, what are they doing? But we are trying to bring in this thing that, okay, you've got it, you've got into a medical college, spend some time to go and see the wards, spend some time to see, why have I done medicine? Is it because there was peer pressure? Is it because my parents said, study, and do become a doctor? But now that I've gotten, and I'm the lucky, because there are lakhs appearing, and there are some 50,000-60,000 who would get into. If I'm lucky to get in here, do I reflect on it and say, am I going to do, things, and start thinking? So the aim of the system is it's changing for the better. And I would like all the students listening to this to say, how am I going to benefit from this and give back? So this is something I'd like to share.
I totally agree with you that this is your mindset. If you think you've wasted time, it'll really be wasted. But you just change the wasted to invested. Then you've invested this time to understand yourself better, to understand your needs better, to understand how lucky you are in whatever you are in life and what you can give back. That is such an important time. And I like to think that this reflection is not something that you do it when and if you find the time. You make time for it. And I like to call it me time. And everyone should have their own me time when maybe you're doing nothing, just daydreaming or just being in the now and enjoying being alive, breathing, without gadgets, without interaction, and even calming your mind. It's a form of meditation. You don't have to be sitting in yogic posture and chanting something to be in meditation. If you do anything wholeheartedly, single-mindedly, and with full joy and involvement, that is meditative. And that's very cathartic to your negative emotions and your stress. We have already exceeded our time.
Yes,
so
Doctor.
Manoj, would you like to wrap it up?
Yes, I would love to actually, Dr. Nilima. In fact, Dr. Madhuri, thank you so much for bringing up some very fascinating inputs. And I also don't want the participant students to miss out very, very valuable life lessons that Dr. Madhuri has put in the chat window. Please look for it. She's answering a question from a student about how she managed time at AFMC. And know that she would also have had worries and all. Yet there are some very fascinating, very interesting tips that Dr. Madhuri has given us on time management during your UG days. So please go through the chat window and find those answers. It will really be very helpful to all of us, I think.
So can I say one point, please?
Yes, Dr.
Please.
The Madhuri ma'am told about how we can use our valuable time. I would like to share one personal experience over here, that when I entered in college during MBBS in the first year, I was a very studious person, and I spent most of my time with the books, and my college was in an isolated place. And that is when over the time to de-stress, I found this new area of photography. I started doing photography with my phone, and it just became my passion over the time. And my photos have been used in Tokyo in a picture studio also. And that is when I realized that you don't know your capacity till you actually try to see it, or you try to find it in you. And being lost in the books is not the world, and we have to see a bigger picture. And being a medical student, I think all of us, apart from doing what we are doing, there is something or the other hidden in us. And there is just one life. If we don't try to find it, it will be lost with us. So I think that is what I think we all should do. Try to find whatever we can.
To be truly successful and
Dr.
happy.
Nilima, if I could quickly add to what Simran said, if just a minute. I attended a TED talk once. As in, it was a sequel to the TED talk where the person actually presented only for me because he was just practicing. So he asked 3 questions to the doctors, in the sense that, what are you doing? What are you good at doing? what are you currently doing? And the answers to all of these three things are medicine. You're good at medicine, you're practicing medicine, you are a clinician. But then the question is, what else are you doing? So I know a lot of people who are plastic surgeons, who are good musicians. I know an orthopedic surgeon who's a stand-up comic. So find that something else, whatever it is, even if it is pottery, clay painting, whatever it is, XYZ, even others don't have to know. But find something that can teach you things that cannot be taught by the materialistic things. And that's very, very important. As a medical student, as a resident, all of us had, and all of you have aspirations. You want to have hundreds of publications, want to have multiple books, you want to be working in the top hospital in the country. Some of you want to go to a foreign country, you want the most expensive car, etc. In my years in medicine, I have seen people who have done all of this. I've seen people who have achieved all of this, but they are still not happy. So find something that is outside of medicine, like Simran said, that actually makes you whole, and it is extremely important.
We are all multifaceted creatures, and if we develop only one aspect of our medical and clinical knowledge, it is at the cost of not developing holistically, and then we pay a price of stress and challenges and other things. So it's very important to grow.
Dr. Nilima Kadambi, you're not going to give credit to, there's one person I just saw on the thing, Dr. Vivek Kadambi. He is an excellent singer, and he's a practicing ophthalmologist, gone into wellness, and at the same time gives performances in music and karaoke. So I think we've got lots of seniors who are doing and learning to have fun while we are working, right? So I think you don't need to look far.
So if one message we want to take home, learn to enjoy every day, every moment, and work will get happening, and studies will keep happening, and success will keep coming. But learn to enjoy every moment and be happy, right?
Can I just request the White Swan and
Yes,
your, doctors for doctors, if you all already have, it's excellent, it can be spread around, but you all can start a mentorship program. There may be a lot of retired teachers who would be able to, so you have an online platform where teachers can sort of, and any student with it becomes like we all brought out that they want to be heard. So it might be something that, someone wants to just talk to this, and you don't have, you don't want to sometimes just talk to your close associates, or you're scared, or your family, and you can talk to a unknown this thing. So you may have senior doctors, and we could start a platform like that.
Maybe instead of a helpline for counseling, we should just have a helpline for listening.
Yes.
In fact, if I may quickly add, I would urge everyone to download, especially the medical students, to download the survival guide. We've already had around 2,000 downloads from the White Swan Foundation website. Dr. Suhas, myself, and a bunch of doctors who are part of this initiative under D4D would want to hear from you. Would you like us to come up with a separate booklet, maybe catered towards junior residents or senior residents? Would you like us to talk about specific study skills for subjects? And we would like to do that. In fact, I'll request Dr. Madhuri to come up with maybe a prototypical paper. That was one of the requests from the participants in the chat, as to how you conceptualized the MAP program at AFMC, and could that be rolled out? After this call, I'm sure the D4D core team will get together, and we will also discuss if we could come up with replicating some of the good practices locally for your medical colleges. So do keep in touch with us, do write to us, do keep us informed.
And with your permission, Dr. Suhas and Dr. Sandeep, I'm going to let the cat out of the bag, that we are working on a addendum to the MBBS survival guide for really coping with COVID for medical students. It'll soon be available.
Yes, thank you so much, Dr. Madhuri. You had a point to make, Dr. Madhuri? Yeah.
I just said we've had a great session, and I think if not closing, if there are any students who would like to, type in any questions for anyone, because we would like to hear their things more.
Yes, Dr. Madhuri. There are a lot of questions that have come in, and one of the things that I think common thread across a lot of the questions and solutions and tips and advice that we've heard from panelists is also communication and opening up. Be mindful. So one is, of course, we can speak about the fact that you should be happy and you should take care of your well-being, but allow the fact that we can still have some problem. We can falter. It's an illness, after all, we all can face, and building a communication channel and making sure that you have people around you with whom you can speak and speak out, reach out is an extremely important message every student must understand. And I think the participants that we have here in this webinar are great ambassadors to take the message across to other students.
My suggestion would be, since we've had such a wonderful participation and so many questions coming up, and I think it has been a very fruitful discussion, maybe we can make this as a monthly webinar that we do it on by a calendar event, and different doctors and different panelists and different specialists can be brought together. And every time it's recorded and made available, it will spread. So let's leverage technology and experience of people who've been there, done that, and share it. And sharing and caring makes the world a better place. So thank you, Dr. Madhuri. Thank you, Dr. Sandeep. Thank you, Dr. Suhas. Thank you, Ria, Simran, and Suyash. And thank you, Manoj and White Swan Foundation for giving the tech support to make this happen and being our collaborators with Indian Medical Association, Doctors for Doctors. Have a wonderful day. Good night.